Coming up on our town hall tonight, we're talking with a health expert on the troubling new trend we're seeing across New York in coronavirus cases. Plus, keeping you safe online because as we found out today, even Twitter can get hacked by something as old-fashioned as a phone call. And the Verify team takes on the battle over the words of Dr. Anthony Fauci playing out in Washington. And we thank you for joining us for this Wednesday edition of our virtual town hall. I'm Kate Welshofer. Michael has the week off. And our conversation starts tonight with a concerning trend that's been building for the last week or so in New York. After months of dropping or staying pretty much flat, COVID-19 cases, hospitalizations, and deaths are creeping up. The state test positivity rate is still around 1%, same as it is here in Western New York, but there are certain hotspots that are much higher, and even here in Erie County, the health department says those numbers are rising as well, blaming it on things like travel, people who aren't showing symptoms, and even just plain old fatigue, just being tired of everything we've had to do the last few months to try to keep this under control. So joining us live to talk more about what is happening right now is Dr. Brahm, Chief of Internal Medicine and Chief of Infectious Diseases at Roswell Park Comprehensive Cancer Center. Dr. Segal, thanks so much for joining us tonight.
Oh, my pleasure.
So we continually hear about the different metrics that the state is using to monitor the virus and prevent large outbreaks. We report it every day. The percent positive is one that is used a lot. But what metrics are you watching to try and see if we're on the verge of possibly another big spike?
Percent positive is one useful criteria. New York State, one source I use, New York State has an app, like it's called the COVID app. So I look at it, I find it to be very useful. You've got the day-to-day variation, and sometimes that makes the news, but recall, especially with Erie County, it's easy to imagine that rates can go up and down within a day. New York statewide, where you're doing a lot more testing, it tends to be more stable. So percent positive can range from a little, on a given day, can range from a little bit less than 1% all the way up to 2%. You're right, the average is probably 1.3, 1.4%. That relative to other states, that's a pretty good average. That's would be considered a low positive rate. I also look, the two go together. I look at the actual rates that are reported. I also look at hospitalization within our county. At Roswell, the number of hospitalizations is extremely low, usually none, sometimes one patient at any given time. But if I'm looking at the wider community, at any given day, we could have somewhere between 40 or 50 patients in the range of 40s, which would be the average hospital census. If we look back several weeks, it was lower, right? It was more like in the 30s, sometimes even below 30. But I know we're going into the weeds a little bit, but if let's say we look from August, September, and now October, the average has been in the 40s in terms of number of people hospitalized. The average positive rate has been 1 to 2% in that range. So I view it as largely, if I'm looking at it not day by day, but week by week and over the past month, I see the rates as being somewhat stable, actually.
And so what do those numbers tell you? Because you talked about it being the percent positive in the region, 1.3%. Right now, the number of hospitalized in the region with COVID-19 is up to 73. So what do those numbers tell you when you're looking at all of that? Yeah. What do they tell you overall?
So let me clarify. I was looking at the Erie County rates. If we include Western New York, that's obviously going to be up. What I would say, I'd say that there's some good news and there's some bad news. Relative to other states, our county and Western New York and New York State is doing far better than most. That being said, I was hopeful, optimistic, that the real precipitous reduction in COVID rates that we saw, through the month in June would be continuing. So we would have a much lower rate. In other words, that would continue to decline rather than a slight uptick and being relatively more stable. But you compare it to, let's say, what went on in the Sun Belt over a good part of the summer in September, where the rates were extraordinarily high. Now those rates are coming down, but we see very high rates in the Midwest, northern west, central northern part of the country. Why is that relevant? Well, people travel. So it's relevant on a, just from looking at things from a national level, but also on a regional level. This is an area where people travel within, they come in from other areas. And, we always have to be careful about resurgence. So right now we're more in a plateau level. Again, maybe, somewhat increased compared to July, but still at a plateau. We certainly can see that level increase, or we can see it decrease depending on how good we are sort of with our social distancing and wearing masks and, all the things that we've discussed before.
Yeah, and on that, Erie County said today that 40% of the patients that are hospitalized in the county are under the age of 65 now. So what do we know about the people who are getting sick and the factors that are causing the spread as it is being spread?
So I can give you an educated guess. I can't tell you specifically about the demographics, obviously, of each patient, but this is what we're seeing nationally and we saw this especially, in the Sun Belt states where we saw a huge increase in COVID, but the hospitalizations were less than expected if we compare that to what we encountered in New York State in March and April. Why is that? It's probably because it was the number of cases was driven by younger people who are less likely to be hospitalized. The bad news is that as the transmission gets less controlled, as it grows and grows, the hospitalizations and the mortality, which are lagging indicators, will catch up. So if I'm looking at it right now and saying, 40% are middle age or younger who are hospitalized, rather than the elderly and people with other comorbidities, the educated guess I'd have is that older people and people with comorbidities are being super careful to not get infected, that it's largely driven by younger, healthier people. And even though the proportion of those who will wind up with a serious infection requiring hospitalization, is much lower than older people and people with comorbidities, it's certainly not zero. So you're in essence, the trend downward in age almost certainly reflects that the increased frequency of COVID infections in that younger, healthier group.
We certainly appreciate your perspective. Dr. Brahm, Segal, Chief of Internal Medicine and Chief of Infectious Diseases at Roswell Park. Thanks so much for being here.
My pleasure. Thank you.